All right, ready to dive in. Today, we're tackling a topic I think we've all had on our minds lately, the impact of therapy on young people.
It's a big one, for sure.
It really is. So we're digging into Bad Therapy by Abigail Shrier.
Okay.
And just to be clear, this isn't about bashing therapy outright. It's more like, are we using it in the best way possible? With the best intentions, are we actually helping young people as much as we think?
Right, right. Because there's always more than one side to every story. And Schreier definitely brings up some thought-provoking points about that, like the idea that we might be overdoing it with the labels these days.
Yes, it's like we've forgotten what normal even looks like anymore.
Exactly.
Like Schreier talks about how we're so quick to pathologize what used to be considered typical childhood behavior,
Yeah, yeah. And that can get tricky, right?
Totally. One example that really got me thinking was the statistic about ADHD diagnoses. Apparently, they've skyrocketed by something like 300% in the last 2 decades. 300%. Is it really an epidemic, or are we casting the net way too wide now? What do you think?
It definitely makes you wonder about overdiagnosis, doesn't it?
Yeah.
And the problem with slapping a label on everything is that it can really mess with a young person's self-image.
Absolutely.
It's like saying, you're not okay as you are, you need fixing.
Right.
And that could become a self-fulfilling prophecy,
Oh, for sure. And then on top of that, you've got this whole trauma-informed approach that's everywhere these days.
Yeah.
From schools to parenting books, it's like trauma is the buzzword of the decade.
Right. It is a bit, isn't it? Now, don't get me wrong. Trauma-informed care is crucial. But the problem, Schreier points out, is that the definition of trauma has become so broad,
It's like we're seeing trauma lurking around every corner.
Right. And it's important to remember that the ACE score, that's the Adverse Childhood Experiences score,
Right.
it was initially meant to look at risks for large populations, not to diagnose individuals.
Oh, I see. So,
It's like using a thermometer to measure the temperature of a room and then assuming everyone in the room has a fever.
okay, that makes sense. So you're saying it's about the way we're using the ACE score.
Exactly. It's like we're misinterpreting the data. And that can lead to overestimating the impact of normal childhood struggles.
And then kids start to feel defined by experiences that are actually pretty common.
Right. And instead of building resilience, we end up fostering this sense of fragility, like everything is going to break them.
Wow. That's a really good point. It's like we're almost doing the opposite of what we're trying to do.
Yeah.
So that kind of leads into Schreier's critiques of some of the common practices in therapy these days. Like, have you noticed how much emphasis there is on constantly dissecting every single feeling?
Oh, absolutely. Like all the time, right?
Mm-hmm.
And it's not that feelings aren't important. They are. But I think Schreier's point is that this constant focus on feeling our feelings can sometimes backfire.
I agree. And
You know.
I was just thinking, you know how some people get really stuck in their feelings and never seem to take action?
Oh, yeah. And that's where Schreier talks about the difference between what psychologists call action orientation and state orientation.
Oh, interesting.
People who are action-oriented, well, they're all about taking action.
Makes sense.
They focus on solving problems moving forward. But those who are more state-oriented, they tend to get caught up in their heads, analyzing their feelings without actually doing anything to change their situation. And what Schreier suggests is that some types of therapy might actually reinforce that state orientation.
It's like that story Schreier tells about Julia, who spends years in therapy,
Right.
Dissecting her childhood, blaming her parents for her unhappiness.
Right.
But it's not until she finally shifts her focus from like feeling stuck to actually taking action,
Yes.
like changing careers and setting boundaries, that she starts to actually see some progress in her life.
Totally.
Yeah.
Because then you're actually doing something, right? And that ties into Schreier's whole point about the happiness trap. You know how we're always told that happiness is the be-all and end-all? Like, that's the goal. Be happy all the time.
Right. But is that even realistic?
Exactly. And Schreier asks, is that even helpful?
Yeah.
Like, could that actually be setting us up for disappointment?
It's true, because when you're always chasing happiness, it's like
Right.
you're never going to get there.
It's like a recipe for feeling inadequate, right?
Yeah.
Because you're never going to be happy all the time.
Exactly. And it's like you're always striving for this thing that's
Right.
maybe not even attainable.
Exactly. And there's more and more research coming out now suggesting that accepting the ups and downs of life, even the tough emotions,
Yeah.
might actually be a healthier way to go. It's like embracing the full spectrum of the human experience,
Yeah.
not just chasing some ideal state of perpetual bliss.
So instead of trying to avoid negative emotions altogether,
Right.
maybe it's more about learning to cope with them.
Exactly.
in a healthy way.
Yes, exactly.
And how do we even do that? How do we approach that?
Well, that's where Shrier talks about this idea of effort after meaning. And it's this idea that when we attribute all our struggles to outside factors, like our parents or, some past trauma,
Right.
it can give us a false sense of understanding. It's like saying, oh, it's not my fault I struggle with this. It's because of this thing that happened to me.
Right.
And while that can be comforting in the short term, it doesn't necessarily empower us to actually create change.
It's like you're always looking backward.
Yes.
Yes, exactly. Instead of like, what can I do to move forward?
Exactly. And this is where personal agency comes in. Shrier argues that we need to reclaim our ability to influence our own lives, even if it means acknowledging the role that we play in our own struggles.
So it's like owning our stories,
Yes.
the good and the bad,
Exactly.
and using that as fuel for growth.
I love that. Owning our stories. And, this all ties into another big area that Shrier explores, which is this increasing reliance on diagnosis and medication,
Oh, yeah.
especially when it comes to young people.
Especially when it comes to young people. And she has that one example, Mayan,
Yes.
the 4-year-old,
4 years old.
diagnosed with severe ADHD and immediately put on Ritalin.
It's like we go straight to the meds.
Yes. Like, are there other options? Hello.
Right. And, Shrier brings up experts like Yaakov Ophir, who argue that in many cases, ADHD doesn't even meet the criteria for a true disorder.
Wow.
So the concern is that we're over-medicating kids with powerful stimulants like Ritalin, and we don't fully understand the long-term consequences.
Right. And then on top of ADHD, there's a whole world of antidepressants and anti-anxiety meds, which is a whole other can of worms.
Oh, absolutely.
Yeah.
And that's something that Shrier digs into as well. And one thing she points out is how quickly we jump to medicate away normal human emotions, like sadness and anxiety.
Right, because it's like we've forgotten that it's okay to not be happy all the time.
Exactly.
Like those emotions are there for a reason.
Exactly. They're information. Shrier says that some degree of sadness and anxiety are totally normal parts of being human. In fact, those feelings can actually be helpful signals that something in our life needs attention.
It's true.
So if we just immediately numb them out with medication, are we missing out on an opportunity for growth?
It's like always taking painkillers when you have a broken leg.
Ooh, that's a good one.
It might mask the pain, but it doesn't actually fix the problem.
Exactly. It's not addressing the root cause.
So if medication isn't always the answer, then what is? Where do parents fit into all of this?
Oh, that's a great question. And one of Shrier's main arguments is that even well-intentioned parents are getting caught up in this whole therapy mindset.
Right. It's like we've all become armchair therapists.
Exactly. She talks about this rise of the therapeutic parent who's constantly analyzing their kids' every move, running to experts for advice at the slightest sign of trouble.
It's like we second guess everything.
All the time.
We don't trust our own instincts anymore.
Right. And we're so afraid to get it wrong.
Yeah.
We're constantly looking for validation from experts instead of trusting our own gut.
So is she saying that's always a bad thing? Well, yeah. And, we've all seen those parents, right? Like every playground dispute turns into a therapy session.
Oh, totally. It's like, let's unpack this, children.
Yeah.
And Shrier really questions whether that's actually helpful for kids in the long run.
It makes you wonder, are we creating more problems than we're solving?
Right. Like, are we teaching kids to be overly fragile, overly reliant on adults to fix everything for them? And, going back to that idea of therapeutic parenting, Shrier talks about how that over-reliance on expert advice, it can actually undermine parental intuition, that natural bond between parent and child.
Yeah, that makes sense.
Instead of trusting their gut, setting firm boundaries, parents end up constantly second-guessing themselves, deferring to outside authorities.
Right, like we're almost afraid to be parents.
Yes, exactly.
Yeah.
Like we don't trust ourselves to know what's best for our own kids.
So we end up sending this message to our kids that they can't handle things on their own.
Exactly. And that can really hinder the development of resilience, personal responsibility.
So it sounds like it all comes down to finding a better balance, right? Like professional help is great when you need it, but we also need to prioritize our kids' ability to bounce back from challenges.
Exactly.
Yeah.
And that's where Shrier talks about the power of subtraction. Essentially, it's about simplifying our children's lives, less screen time, fewer scheduled activities, more unstructured playtime.
So less is more, basically.
In a way, yes. And she talks about how in cultures like Japan, where kids are given a lot more freedom and independence,
Oh, interesting.
they actually have lower rates of anxiety and depression among young people.
See, that's what I was thinking. It's like by trying to shield our kids from every little thing,
Right.
we might actually be making them less equipped to deal with the real world.
Exactly. Because they haven't had a chance to develop those coping skills.
Yeah.
And Shrier talks about the importance of boredom.
Boredom, really?
Yes. Because when kids are bored, that's when they have to get creative, right? They have to use their imaginations, figure things out for themselves.
It's true. Some of my best childhood memories are from those long summer days when we had absolutely nothing planned.
Right. And that's when the magic happens. It's like we've forgotten how important that unstructured time is for kids' development.
Yeah, I think you're right.
And, along with boredom, Shrier also talks about the importance of letting kids take risks.
Okay, now this is where I get a little nervous as a parent.
I get it. I get it. It's hard to fight that urge to protect them from everything.
Right.
But it's about finding that balance. We don't want to throw them to the wolves, but we also don't want to wrap them in bubble wrap.
Okay, that makes sense. So not too much, not too little, just the right amount of risk.
Exactly. Like, Shrier tells this story about how she let her sons go for a drive with their grandfather, even though she was a little nervous about it.
Yeah.
And it ended up being this really positive, memorable experience for them. They learned about responsibility, they faced their fears, they had an adventure.
See, and that's the stuff they're going to remember.
Exactly. And it probably brought them closer to their grandfather, too.
So it's about trusting our kids a little more.
Yes. And trusting ourselves as parents, even though it's hard.
It's true. We don't always have to have all the answers, right?
Yeah, exactly. And it's okay to ask for help when we need it, Not just from experts, but from our communities, our friends, our families.
It's like building that village.
Yes, exactly. We don't have to do this parenting thing alone.
Well, I think this has been a really insightful conversation. Bad therapy really makes you stop and think about some of these assumptions we have about mental health and parenting.
I agree. It's a real eye-opener. And, more than anything, it's a reminder that sometimes the best thing we can do for our kids is to take a step back, let them figure things out, and maybe even rediscover the power of laughter and connection along the way.
Just be present.
Exactly. Be present, be supportive, but also give them the space to grow.
I love that. Well, thank you so much for joining us for this deep dive.
It's been a pleasure.
To our listeners, we'd love to hear your thoughts on this. How do you navigate these challenges in your own life? You can find us on social media, join the conversation. Until next time, keep exploring, keep questioning, and keep diving deep.